What if I told you a brain tumor could grow inside your head for years, and you wouldn't feel a thing? No headaches, no seizures, absolutely no warning signs. This isn't the rare scenario. It's the reality of meningioma, one of the most common and quietest brain tumors out there. A meningioma is a tumor that forms in the meninges, which are the protective layers surrounding your brain and spinal cord. It's called an extraaxial tumor, meaning it doesn't grow from the brain tissue itself, but rather on the outside, pressing in. Now here's a crucial fact. Meningioma is the most common primary brain tumor in adults. It makes up about 35 to 40% of all primary brain tumors. The good news is that most grow very slowly, and over 80% are benign, meaning they aren't cancerous. But because of where they grow, even a benign tumor can cause serious problems as it puts pressure on vital brain structures. One of the most striking things about meningioma is its strong preference for women. It's 2 to 3 times more common in women than in men. Why is that? Well, scientists have found that many of these tumors have receptors for hormones, especially progesterone and sometimes estrogen. This connection explains why they are more common in women, can sometimes enlarge during pregnancy, and may grow faster during periods of hormonal change. This tumor is most often diagnosed in middle-aged to older women. So, what are the known risk factors? The single strongest risk factor is exposure to ionizing radiation, especially radiation to the head during childhood. Other factors include being female, getting older, and certain genetic conditions, most notably neurofibromatosis type 2 or NF2. However, it's important to know that many people diagnosed with a meningioma have no clear risk factors at all. These tumors are masters of stealth. They often grow at a snail's pace, just a few millimeters per year. Your brain is incredibly adaptable and can slowly make space for the growing mass, which is why symptoms might not appear for a very long time. It is not uncommon for people to live for 10 or even 15 years without knowing they have one. In fact, many meningiomas are found completely by accident, maybe on an MRI done for an unrelated headache or after a minor head injury. When symptoms finally do show up, they depend more on the tumor's location than its size. For instance, vision-related symptoms are very common when the tumor is growing near the optic nerve or the sphenoid wing area of the skull. A person might experience a gradual loss of vision, things looking blurry or dim, losing their peripheral vision, or even double vision. Often, one eye is affected more than the other. And because this vision loss is so slow and painless, it's incredibly easy to dismiss it or just assume you need a new pair of glasses. Other potential symptoms include persistent headaches that get worse over time, or the sudden onset of seizures, which is a very common first sign for many patients. You might also see personality or behavior changes, memory problems, or weakness and numbness in the arms or legs. This really highlights how a small tumor in a critical spot can be far more dangerous than a large one located somewhere else. The diagnosing a meningioma is typically done with an MRI of the brain with contrast. Radiologists look for classic signs like an extraaxial mass that's attached to the dura, the outermost layer of the meninges, and something called a dural tail sign. So, while a meningioma is often slow-growing and silent, especially in women, it's not something to be taken lightly. Early detection is absolutely key to preventing permanent neurological damage. If you notice your vision is changing, even slightly, or if you or a loved one experiences a seizure out of the blue, please don't ignore it. Talk to a doctor. Taking those subtle signs seriously can make all the difference. Thanks for watching, and if you found this information helpful, please like and subscribe for more.